Hi, I'm Lauren Killar, physician assistant with Dr. Lou working on our weight clinic program. The topic of today's conversation is what we learned at the American Society of Bariatric Physicians Conference, which was held in October from the 9th through the 13th of this year. So the title of the presentation is Pearls of Wisdom, I didn't know that, and Aha! So the first thing I want to start out with is defining bariatrics. Many people think of bariatrics when they think of bariatric surgery, the surgeries that people undergo to have weight loss. But bariatrics is actually a branch of medicine in and of itself. It deals with the causes, prevention, and treatment of obesity. The term is relatively new. It was created around 1965, and it comes from the Greek bar, which means weight, IATR, treatment, and IC, pertaining to. So it's pertaining to the treatment of weight. The field encompasses dieting, exercises, and behavioral therapy approaches to weight loss, as well as pharmacologically and surgery. Interestingly, there are only 750 bariatricians, medical weight loss specialists as opposed to bariatric surgeons, in the United States to treat over 200 million overweight people. We've seen this slide before, and this just shows the increase in obesity among U.S. adults. This is looking at the number of persons that have a body mass index of greater than 30, which translates to about 30 pounds overweight for a person that's about 5'4". And as you can see, in 1990, less than 15% of the population was considered obese. And in the year 2010, there are a fair number of states that have over 30% of the population as obese. And if this was showing overweight, which is a BMI of 25 or greater, about 60% of the population now is actually overweight. So it is definitely a growing problem. On June 21st, 2013, the American Medical Association finally recognized obesity as a disease in and of itself. This was a very important milestone in the treatment of this disorder. At the conference, we heard from the representative of the American Society of Bariatric Physicians and how he lobbied the AMA to recognize obesity as a disease. Increased body fat both directly and indirectly promotes and/or causes adverse health consequences, and thus by definition is a disease. And one of the points he made that I thought was so fantastic and really well put is the suggestion that obesity is not a disease, but rather a consequence of chosen lifestyle exemplified by overeating and/or inactivity, is equivalent to suggesting that lung cancer is not a disease because it was brought about by the individual choice to smoke cigarettes. I think that's a very powerful way of expressing it. So another presentation we heard addressed this as well. Historically, obesity is viewed as a lifestyle choice or a character flaw in that someone doesn't have willpower or there's something wrong with their psychology or something like that. The current perspective in recognizing this as a disease, there's a very complex physiology, and we'll get into a little bit of this later in the talk. It's epidemic from changes in the modern environment. Think about how portion sizes have increased over the years. And also, as again, we'll address a little bit later, the switch from eating high-fat foods to eating high-sugar, high-carbohydrate foods. It's widely recognized as a disease, and there's a huge burden associated with this illness. It's a cause of more than they actually said. This is up to 70 medical disorders, including more than 12 types of cancer have been associated with being overweight or being obese. So obviously, it has a devastating effect on the efficacy and quality of life. So what does this mean to the patients that this has been recognized as a quote-unquote disease? Standardized clinical guidelines for better treatment will result from this being recognized as a disease. So no more simply telling patients, eat less, exercise more, and that's the end of the discussion. You're overweight, push away from the table, get on the treadmill. There's got to be a lot more to it than that. And the American Society of Bariatric Physicians has actually developed an obesity algorithm, a very detailed roadmap for how patients who are overweight or obese need to be addressed and how you correct the issue. This also means that now that this is recognized as a disease, that there will be increased insurance coverage for visits and medication. One step towards this in Medicare is covering intensive behavioral therapy for the treatment of weight issues, up to 20 visits a month. 20 visits a year, And likely when Medicare does something, other insurance companies will follow suit. Also means there'll be increased education and research in the treatment of obesity. It's now becoming, bariatrics is now a residency that doctors can go through, and more doctors will be educated to treat the condition. We've already discussed the fact that obesity and being overweight is responsible for a wide variety of medical complications, and this just shows that virtually every organ system in the body can be affected. Again, 70 different diseases, over 12 types of cancer. So the health benefits of weight loss are tremendous, and one of the aha moments or take-home points we got from the conference was that as little as 10% body weight loss results in tremendous health benefits. This slide shows an incomplete list of all the different conditions that can be improved by losing 10% body weight. And if you think about it, 10% is 25 pounds if you weigh 250 pounds, 19 pounds if you weigh 190, etc. But what I think was even more interesting is evidence was presented that even less weight loss can provide significant health benefits. So for example, 1% weight loss decreases your risk of developing diabetes by 10%. 1 pound of weight loss can take 4 pounds of stress off of each joint. That's very significant if you have something like osteoarthritis or some other type of joint issue. And I think another thing that's very exciting and important, and something that some of our patients have already experienced, is the ability to decrease or stop medications for conditions that are brought on by being overweight or obese, like hypertension and diabetes. So how do you lose weight? Well, the old thinking was it was very simple. The energy balance equation, calories in, calories out, or energy intake versus energy expenditure, what you eat versus how much you move. So it's easy. Not. Much more complicated than that. This is a relatively simple diagram, believe me. It's a lot more complex than this, showing that how complicated regular eating and the regulation of how our body processes food is so complicated. It results from the interaction of multiple organ systems, hormones, and other chemicals that are influenced by genetics, the environment, and many, many, many other factors. An aha moment for us, and I guess maybe not really an aha, we kind of knew this, but the point was really driven home at the conference about the difference in how macronutrients are processed by your body and affect your body. So the 3 macronutrients are proteins, fats, and carbohydrates. And what we learned is proteins are really good for you. Fats actually not so bad in moderation. Carbohydrates are the problem, and we'll get into more details on this in a second. Interestingly, in the 1960s, the correlation was made between eating too much fat, cholesterol levels, and heart disease. So there was a big push to get people to stop eating so much fat. So people started eating less fat, and the food industry responded. Now, the thing is that fat makes food taste good. So if you take the fat out of food to please people and, supposedly make the food more healthy, what are you going to do to make it taste good? You add sugar, you add carbohydrates. This slide shows a couple of different examples of some of the things we learned about how the shift in American diet from eating high-fat foods to eating high-carbohydrate, high-sugar foods correlated with the increase in obesity and with diabetes. So in the first graph there with the black background, it's a little hard to see, but it shows us as our calories from fat have decreased over the years, the obesity prevalence has increased. The next graph shows high fructose corn syrup consumption, or just sugar in general. And again, it shows that as we ate more and more of this product and more sugars, the rate of obesity also increased. And then the bottom graph shows that even more complex carbohydrates are responsible. This shows in the little dots the wheat consumption increase in the United States and the percent of obesity. And you could literally substitute diabetes incidence for obesity incidence in these graphs, and there would be a direct correlation. So eating less fat and more carbs has led to an increase in obesity and diabetes. But why? Well, one thing that's for sure is a calorie is not a calorie. They used to say all the time, a calorie is a calorie. It's just number of calories you eat, number of calories you burn. Well, that is not true. And that, again, goes back to this very complex system of how all this stuff is processed. Fat and protein make you feel full and satisfied. Carbs make you want more. Carbs are processed by the body differently. They induce different hormones and are turned into triglycerides and actually lead to an imbalance in lipids more so than even eating fat, which is something that really was not appreciated until a little more recently. An example of this is there are two hormones that are very important in the regulation of eating and feeling full. One is called leptin, and leptin is a hormone that's produced that gives you that satisfied, full feeling. So 15-20 minutes after you eat, leptin levels start to rise and tell your body, hey, I've got enough, I'm satisfied. Ghrelin, great name, ghrelin, is the one that makes you feel hungry. So as your stomach's growling, your ghrelin levels are really high. Proteins and fats increase your leptin levels and suppress your ghrelin levels. Carbohydrates do the exact opposite. They suppress leptin and increase ghrelin. So carbohydrates may kind of make you feel full for a little while, but they're going to make you hungry later and make you crave more. So this brings us to the thought that carbohydrates are actually addictive. And the evidence for this is, it meets many of the criteria for an addictive type substance in that you crave more, it can create a tolerance level where you need more to feel satisfied, etc., etc., etc. This is outlined here in another talk that was presented, and it discusses the actual criteria for addiction as defined by a psychiatrist and psychologist. So again, carbs will, lead to cravings, which leads to binging, which leads to withdrawal, negative emotions, and all kinds of things go into that. The DSM-5 is sort of the Bible for psychologists and psychiatrists. It is where all the different definitions of the different psychological diseases, conditions are listed, and there are criteria that need to be met to say that someone is suffering from a particular disease. So in this case here, we're talking about addiction. And what this says is there are 11 different criteria. If only 2 of the 11 are met during a 12-month period, you're an addict, okay? So do carbohydrates cause an addiction? I'm just going to pick up a couple of these here. Withdrawal. You are away from carbs, you want more. Craving or a strong desire to use. Of course, carbohydrates cause cravings. Let's go down to number 6. Use despite social or interpersonal problems caused or exacerbated by use. Becoming overweight, causing both social and health issues. Taking the substance in larger amounts over a longer period of time than intended. Attempting to quit or cut down, etc., etc., etc. I would say the carbohydrate sugar certainly meet more than 2 of these 11, and they certainly affect you for, over your whole life. So that's carbs. So what else can affect weight? Sleep. Sleep loss has been linked to obesity, and for many reasons. One, you're simply more tired, so you do less. You have reduced activity, you don't feel like exercising, which can lead to being overweight. Down at the bottom there, it provides you with the opportunity to eat. If you're not sleeping, you're hungry, you wake up, you need that midnight snack, whatever. And then that type of eating usually results in an increased a drive to eat more energy-dense foods, so more carbohydrates, more fats, etc., etc., etc. Sleep also affects those hormones I just talked about. It results in low leptin, or the low levels in the hormone that makes you feel full, and it increases your ghrelin levels, that hunger hormone, and many other hormones are involved. So all this can lead to obesity. What else affects weight? Stress. And everybody knows this too, I think. Stress, chronic stress, results in the increase of hormones like the glucocorticoids and cortisol, which dramatically affect the way the other hormones in the body have their actions, and can result in the increase in the desire to eat, result in decreased energy metabolism or the breakdown of fat, and all kinds of things. And again, chronic stress, you can see, causes you that increase in that hormone ghrelin. Okay, so what else affects weight? Exercise, and we've talked a little bit about this before. And again, what we've realized is that exercise is more important probably for maintaining weight loss than, actually losing weight. Again, you have to burn 3,500 calories to lose a pound. And I don't care what the machines in the gym say, if you're increasing at a moderate level, that means you can talk, but, you need to take a breath, and, it's not super easy to talk, and you're doing that for an hour. I don't care what you're doing. You're burning about 300 calories, not much more than that. So, when that Zumba instructor tells you you're burning 600 calories, don't buy it. Or if the Stairmaster tells you you burn 600, that's probably not true. So anyway, that means you would have to do 10 hours worth of exercise or more, actually, 15 hours to burn, 1 pound basically. But that said, not good for weight loss, but it is very important for weight maintenance because it results in the buildup of muscle, which uses calories more efficiently and has lots of other cardiovascular health benefits and all that kind of stuff. So the health benefits of exercise are tremendous, and that's kind of illustrated here. So if you look at the graph on the lower left here, this is the incidence of type 2 diabetes among different fitness levels. And this is looking at people with a body mass index of less than 27. Now remember, a body mass index between 25 and 29 is considered overweight. So this isn't even people with what's considered a normal body mass index. This is a little bit overweight. And then people with BMIs over 27, again, not obese, just overweight. And the dark black bars show you, the percent of diabetes in people with that fitness level, or who are very, very highly fit. And then the lightest bar there shows you people that are not fit. And what you can see is for the BMI less than 27, that light bar there, the low fitness level, the incidence of diabetes in those people is actually a little bit higher than the people with the higher BMI, that dark bar on the BMI over 27, that are very, very fit. Now, of course, being overweight and unfit is really bad. That has the highest incidence of diabetes, but it does suggest that fitness is a tremendous part of health and wellness. The other graph then, fitness versus fatness, is the relative risk of all-cause mortality. So this is anything that basically that kills you. So developing a chronic disease or having a sudden heart attack or whatever. And again, it's broken down into normal weight and fit, normal weight and unfit, overweight, BMI 25 to 29, and fit, overweight and unfit, obese, BMI over 30, and fit, etc. And again, it's making the point that people that are obese and fit or overweight and fit actually have a lower death rate than people who are normal weight and unfit. So again, making that point. So how much exercise? Well, initially to start out, the recommendation is what we've kind of been telling you all along, 150 minutes per week of moderate intensity aerobic exercise. So that's 30 minutes, 5 days a week, plus resistance training. So lifting weights, stretchy bands, push-ups, that kind of stuff. Resistance, putting resistance against your muscles to build them up and make them stronger and increase your muscle mass. Now, the thing that's interesting is you don't have to do that 30 minutes all in once. 10 minutes at a time is fine. So if you can manage to squeeze in 10 minutes here and there of a nice brisk walk or whatever it is you do for your aerobic training, that's great. Now, again, this is a good rule of thumb for the weight loss phase of the program. Once you get into maintaining weight, though, to maintain weight, you really have to ramp up the level of exercise that you're doing. And this may be the subject for another talk, but at some point we'll talk about your set point. Once your body's at a certain weight for a period of time, it thinks it needs to be at that weight. So you can lose a good bit of weight in, say, 6 months or whatever, but your body's still going to think, I need to go back to what my weight was before I lost all that weight, and your body's always going to be fighting you. And it takes sometimes as much as 2 to 3 years of maintaining a new weight for your body to readjust and say, okay, this is now what my weight's supposed to be. And increasing your level of exercise 300 to 400 minutes a week. I know that sounds like a lot, but we'll talk in subsequent presentations about how you can do that, is what's required to really help you get to that set point maybe a little bit faster and help you maintain weight loss. So what's moderate intensity? I referred to this already. There's actually something called a rate of perceived exertion. And it's kind of an easy way to keep track of how you're doing. It really correlates very well with your heart rate and increasing your heart rate. So the level you're talking, you want to be at a 4 or 5, which is moderately easy. You can converse with a little bit of effort. You can't sit here and lecture like I'm doing right now. You kind of want to have somebody else that occasionally you're taking a break and letting them talk. But you can talk in, longer phrases, maybe full sentences, and then have to take a little break. At 5, it's really starting to get challenging. You maybe have to take a bit bigger breath or breathe heavier even while you're talking. But that's the level we're talking about when we say moderate exercise. And for the rule of thumb is that's walking at about 4 miles per hour, about doing 15-minute miles. Now, of course, depending on your fitness level, that is. But that's sort of what for most people would be kind of moderate or moderate intensity type exercise. Okay, so that's basically the updates from the conference that we learned about, and we'll have future presentations and get into a lot more detail on some of this stuff, particularly the whole carbohydrate question, because it's, again, a little more complicated than that, in that carbohydrate is not a carbohydrate either. There's sugars, there's complex carbohydrates, etc. So we may get into more information on that and how that affects you. But these are topics for a different time. We do have some upcoming exciting news, though. We recently acquired a body composition scale, and so we'll be incorporating that into your care. We have guest speakers coming up for some future group meetings. We have a behavioral therapist coming in on the 20th of November at 6 o'clock, who's going to talk a lot about the upcoming holidays and coping with the stress of those and coping with all the temptations in terms of food and things like that that we'll all be experiencing over the holidays. So that's going to be a really good one. Hopefully most of you can make it. And then we're going to have a meeting our third Wednesday in December with a physical therapist who's going to talk to us about exercise and maybe show us some examples of simple exercises we can do at home or anywhere. And that should be really, really fun too. So hopefully you'll be able to make our future meetings. Okay, so to summarize, what we learned from the conference is weight gain is the result of a very complex process. Eating sugar is an addiction. It takes intensive behavioral therapy, 3 to 6 months, to change the habit. Relapses happen, but it doesn't mean failure. It just means we can do better next time. Successful weight loss needs low carbohydrate, high protein diet, stress reduction, getting adequate sleep, and getting adequate exercise. And at the actual meeting, we challenged everyone to come up with an action plan. Pick 2 areas you want to work on this month. Now, obviously, if you're in our weight clinic program, you already have been prescribed a low carb, high protein diet. So that one doesn't really count. So, we ask people to work on stress reduction, getting adequate sleep, and exercise, or increasing activity. And let's see. So then we talked about increased physical activity, how it has benefits. Physical activity, again, is defined as any movement, exercise, as planned activity. So it's kind of a subset of physical activity, but it's very specific. So we did a group activity where we could talk about how we could increase activity, and with our busy lives, how we could make time for exercise, and how we can make sure we stick to the plan. And people tossed around some ideas for that as well.